Hey there, I'm Brittany Sanderson, nurse practitioner.
And I'm Cumming, registered nurse from Meridiem DermSpa in Farragut.
And we would like to welcome you today to our RHA virtual event.
We'd like for you to stay tuned after our full presentation because we're going to have a live Q&A.
Yeah, so stay tuned. We look forward to answering you guys' questions after the event. Thank you.
Hey everyone, so I'm going to tell you a little bit about RHA. RHA stands for resilient hyaluronic acid, which we all have in our bodies. It's our natural moisturizer. But as we age, we lose that, we metabolize it and lose that volume. So we have dermal fillers to, replenish the volume and give us that healthy support that we need. So RHA is a phenomenal product. I've had it for a couple of years now. I've been doing dermal fillers for about 4 or 5 years. I've been in dermatology for 8. And the one thing about RHA that is really unique is it's very versatile. So I have a lot of flexibility with it. It's very natural. So it's the only filler that's FDA approved to not only have the strength and resilience, but it allows you to have those dynamic facial movements which look natural. Especially when we're injecting around, your mouth, we move, we speak, and I want it to look fluid. So I have a lot of flexibility with the product. It's very, like I said, well made, it's versatile. The product, the quality of it is phenomenal. I'm really impressed with the company and the research they've done, and it's something I've been implementing and getting phenomenal results. So this has been one of my products I've been using a lot lately. Patients have been really happy. The longevity is phenomenal, and I'm also training other providers how to use this product because it's so unique, and there's some really exciting techniques that I can do with this that previously I just didn't have the opportunity. So.
Okay, so we decided to bring the RHA Collection into Meridiem DermSpa to meet a need for some of our patients. We wanted something that was going to be dynamic, so when our patients smile and speak, the product actually stretches and moves with the face. Okay, so RHA treats a number of different places on the face. We start with the mid-face here. It treats the cheeks here, and also with the smile lines. When you smile, you get the big lines here. RHA is also FDA approved to treat the nasolabial folds as well as the marionette lines and the perioral lines.
So, who is a good candidate for RHA? Anybody that has a wrinkle. So, everybody, right? Kind of joking, but kind of not. RHA is such a wonderful product. It really can be used for anyone, young, old, anyone, who wants to see any sort of correction in their face. It's very natural looking. You're not going to look overdone. You're not, going to look abnormal. You're not going to look like yourself. With RHA, you're going to get such a subtle, natural result, but it's going to make a big impact.
So after treatment with the RHA Collection, you can see your maximum results at 4 weeks out.
RHA does have an indication that it lasts for 15 months. We do, though, recommend that our patients come in annually, once every year, to get retreatment. That way, you're never fully losing all of the treatment that you have received, but we're just kind of adding a syringe or two to maintain yearly. But we do have that 15-month indication for RHA.
Absolutely love it.
Beautiful.
You did a wonderful job.
Thank you. So you can see, you know, much more balance in the cheeks. We addressed the nasolabial folds, marionettes. So honestly, addressing the cheeks really made a difference to lifting this up. Then we went in and addressed that and addressed some of the perioral lines around the mouth as well. We used RHA 4, 3, and 2 today.
Okay, so we've done a half correction on Lisa here. We have done some RHA 4 here in the cheeks to give her some lift. While we did this, we were able to pick this nasolabial fold up here. We did some RHA 3 here and RHA 3 through here.
So we have Joy here, our lovely patient. We are going to do a comprehensive treatment using RHA dermal filler to just enhance. I mean, she's got some beautiful features, but we're just going to enhance them. You know, give her a little bit of that mid-face volume. So immediately when I look at Joy, I always, look, right in the mid-face. So as we age, unfortunately, we lose, that volume, the fat pads, bone even, so things, tend to fall down and in. So that can give us, some lines that are in the nose and mouth, and we lose some kind of, cheek structure. So what I'd like to do today is really just give her a little bit more volume. So Joy, if you look in the mirror, so what I'd like to do is give your face just kind of a little lift, just kind of bring you up a little bit, give the cheek a little bit more contour, and you can kind of see how your lower face starts to come up as well. And then I'm gonna also treat back here to kind of bring up that lower, we call it, the pre-jowl area, and just kind of tighten the jawline a little bit, and then give you, like I said, a little bit more contour, so we'll have a nice convexity, and it will make your face look more heart-shaped. And really, it's gonna be subtle but very complimentary, but very natural. It's a really, I think it's gonna look really good.
Sounds good.
All right, let's do it. So I just completed her right side, so you can already appreciate the contour here. So if you notice this mid face, we've got the nice convexity from the her ear to nose, so it really gives her that nice contour, as opposed to the side where you can see that kind of flattening. This little nasolabial fold has already softened. Her little pre-gel area looks like it's just her jawline sharper. The corner of the mouth just has a little bit of more of an upturn, so that the volume just looks healthy. It's in the mid face. She just looks refreshed, just rejuvenated, rested, but it's very complimenting. It's natural, and what I love about this product is how versatile it is, because I'm able to do, areas where she needs, to have movement, but it looks so natural because of that, dynamic ability to be, flexible but strong. So that's why this these products are just really phenomenal. So I'm able to provide great results that looks natural.
Thank you so much for attending our RHA virtual event with us today.
Please check your text messages and reply back yes if you'd like to book an appointment for a consultation.
And also, if you guys want to, you can stay tuned and hang out with us for the next 15-20 minutes, and we will be answering all of the questions with the Q&A question box. All right, thank you guys.
Hello, hello. We have everybody coming in today. I'll be reading questions for everyone. If you want to go ahead and introduce yourselves.
Hi, I'm Cam.
Hi guys, I'm Brittany. I'm a nurse practitioner in Farragut, Knoxville, Tennessee.
And I am Suzanne Cerrone. I'm the NP in Carroll County, Maryland.
Perfect. We will go right into the questions. I will start with you, Suzanne. All right, we have a question coming in. Can you do anything for crow's feet or what they call the number 11?
Yeah, I mean, I typically like to do treat those areas based on the cause. You know, obviously that area tends to be more from a muscle contraction. So sometimes neurotoxins such as Botox are the better choice. But Botox and filler are best friends, and they go together very nicely, and they complement each other. So that's something that I would probably treat with kind of a combination. Sometimes, you know, it's more of a laxity issue that the crow's feet are having. Sometimes it's just a muscle contraction. So I'd have to assess the patient, but absolutely we can address that regardless with some type of treatment.
Okay, Cam, what would you say? Somebody asked if RHA is a better option over Juvederm or Restylane.
So I've actually come across that question quite a bit, and really, when I assess the patient, I'm looking at your health history to decide whether or not which product is best for you. Sometimes I'm also looking at what you've had in the past. So if you've ever been injected before, I kind of look at that, how long it's been since you've been injected. So, you know, personal assessment is actually the best.
Perfect. Let's see here. All right, Brittany, if you have already had filler in the last 7 months, would you recommend being able to get RHA done, or when would you recommend trying to get it?
So that really will just depend on the consultation. You can be retreated with filler that quickly, even if you have had filler in the last 7 months. But again, that's kind of a case-by-case basis. We will just, you know, have you come in, assess your face, kind of, you know, talk through what fillers you had done, where you had them done, and be able to, you know, decide person to person whether they need more correction. But as far as just the general, can you have filler if you've had filler in the past 7 months? Yes, you can.
Awesome. So, Suzanne, what would you say if there's any bruising or downtime after injections? What does that usually look like?
So absolutely. I mean, anytime you get injections, there can be mild swelling and bruising. Thankfully, you know, it is, you know, it spontaneously resolves, and there's ways we minimize it. I typically tell patients to, I'll give them a pre-filler kind of instruction sheet telling them certain supplements to avoid, ways to kind of prep for the treatment day. We have a great post-injection serum that really helps with swelling and bruising. Obviously, we recommend ice in the area. Sometimes I'll even discuss, possibly taking an antihistamine. But thankfully, the bruising is very typically minimal, and obviously resolves, and you can kind of conceal it as well. But it's not, I tell patients there's always a chance of bruising. I won't ever, guarantee no bruising or swelling. Thankfully, like I said, it is a quick recovery.
Awesome. All right, Cam, I know that y'all did say it's good for any age. So we have a question. Would it improve fine lines around the mouth of a 78-year-old?
Absolutely. I think there's a place for that. I have some patients that are in that age range, and I have successfully used an array of the products, the RHA 2, 3, and 4 in the perioral areas to help with the perioral lines, as well as give support to the oral commissures.
Awesome. Okay. Brittany, if I sleep on one side, so obviously I smush my face a little bit. So could it be used to kind of bring my face back to looking more even? So obviously do I need one on more side than the other?
So I like to tell, every patient, no one's completely symmetrical. So if you've ever, done one of those, they have like face editing apps and stuff where you take half your face and you duplicate it and you're symmetrical. It looks weird. So we are all asymmetrical people. So with that being said, there's definitely, it's not just a 50-50 correction for most patients. So we do have, a lot of patients are sleeping on one side over the other and may experience more volume loss on that side, along with just genetically that the facial symmetry is off. So yeah, we definitely correct based on the patient, not just a formula of half a syringe one side, half a syringe the other side, or something like that.
Perfect. Suzanne, which RHA is your favorite, and where is your favorite place to put it?
That's tough. I think I would probably go with RHA 4. I'm a big mid-face, cheek injector, only because I'm methodical, and that's kind of the foundation of our face. And lately I've been able to add a little bit to the lower face to kind of bring back the jawline. And it's a really unique technique that's specific to RHA 4, and it's been providing phenomenal results. So I'm going to have to go with RHA 4.
Awesome. So on that, I'm going to send it over to Cam. And on a man, could you use this to create a stronger jawline? Like if they don't have a very strong jawline, could you create a jawline on a man that looks a lot stronger?
Absolutely. I definitely think you can put it on the jawline. I think the indication for RHA 4 is mid to deep dermis. And so I think that I've also played a little bit with the jawline on female, but it's just going to be placement and volume that you're adding.
Awesome. Brittany, this question is, I have a resting sad face. So the corners of my lips turn down. So where could I get RHA to help me not look sad when sitting still?
So that's actually a really common question. As we age, the corners of our mouth tend to turn down over time. And so obviously, we'll consult and we'll decide which exact areas need to be addressed. But typically you can add support to your marionette areas underneath the lips, as well as the oral commissures themselves, sometimes injecting in the actual vermilion border of the lips, which is the pink part of the lips as well. But typically the most common injection for turning up the corners of the mouth is just going to be to add support back to those oral commissures right at the corners of each of the sides of the mouth.
That sounds so easy when you say it. All right, Suzanne, would you say that this would be considered as a preventative type of filler over other treatments? So I guess maybe compared to like Botox, would you consider this to be preventative?
You could classify it as preventative, in I guess by defining it as it's preventing from additional volume loss. When you have, like I said, that facial structure intact, things are not falling, and you don't have that stress in the ligament. So by keeping things up, and back and keeping that volume, you're therefore preventing additional loss. So sure, yeah, absolutely.
All right, Cam, what would you say are the main differences between 2, 3, and 4?
So the differences, I think, is the consistency of the product. So you have, and then the stretchability of the product. So 2 is your the one that stretches the most. So you use it into the areas. I think I tend to use it around the perioral areas, or when you have a softer line. Then you have 3, which is kind of in the middle of, obviously, between 3 and 4, as far as strength and flexibility. And then you have 4, which is your strongest product. It's going to give you the most support and the least amount of stretch.
Okay. Okay, Brittany, I know that we're not going to go into cost because that's hard to do, virtually without being able to see anybody. But what would you say the average cost is compared to other fillers?
I would say that the RHA line is pretty comparable with the Juvederm and Restylane and other filler lines out there on the market. But yeah, we really can't discuss price or tell you the cost of the fillers or products without doing a consultation. We do have different pricing structures based in different states. And also, it's just, we have to do that full face assessment to really be able to decide price and cost.
Perfect. All right, Suzanne, if I take blood thinners, would I have to come off of those prior to getting my filler done?
No, I don't have my patients discontinue blood thinners. Obviously, they're on those for a reason, and I would never want to compromise, their health for cosmetic treatment. We just anticipate possibly, potentially some bruising, and we there's some ways we try to prevent that, and like I said, by utilizing different resources, but it's not a contraindication, and I don't have them just if they're taking like a supplement kind of for voluntarily, but not if they're taking something that was prescribed by their physician.
Okay, and then another one that is for you, Suzanne. They just want to know, how many years have you been injecting?
Well, I've been in dermatology, so I started in medical surgical dermatology, and then I transitioned to aesthetics about 4.5 years ago. So I've been in derm about 9 years total, and then been injecting for about 5. So.
Awesome. All right. Okay, and let me see here. All right, Cam, I'm not sure if you'll have the answer to this one, but I'm going to throw it at you. Is the cost the same for 2, 3, or 4? Or is 4, like, for example, the strongest, so would it cost the most? So I guess, does the price vary by which number it is, or are they all priced the same, if that makes sense?
It does. For our particular office, the syringes are all priced the same. The difference is going to come in the number of syringes that you need versus the area. We don't treat per area; it's just by syringe.
Okay, perfect. All right, Brittany, what is involved in the pre-injection prep? Do you use topical lidocaine?
So it depends on the areas that we're injecting and, kind of patient preference. Obviously, if someone asks for numbing or feels very strongly about that, we will do that. I typically, depending on the area, do different things. So like for the cheeks, I tend to ice. It keeps them from, sitting around and waiting with the numbing cream on, but I also think that it penetrates a little bit deeper and really helps with that initial stick. For the lips, I do tend to use some numbing cream as well as ice. If we're doing cannula in the cheeks, I tend to just inject a small bolus of lidocaine right at the entry point. So I would say, as far as whether we use the lidocaine or not, it really just depends on the injection and what areas we're injecting.
Okay, perfect. All right, this one is for Suzanne. Will there be any kinds of lumps after the injections, or will there be a smooth look to the enhanced areas?
There can be some, a little bit of, not typically visible. Mostly patients might be able to feel a little like texture or a bump or so for about a week after the procedure, and tell patients that's absolutely normal. The hyaluronic acid is going to be, your body's just going to embrace it. Your skin matrix will just kind of, bring in that product. So it's naturally occurring in our bodies. So again, it's not visual, but sometimes patients can kind of feel a little bit of, the texture or like a little bumper. But again, it's very mild and it subsides very quickly. And it doesn't always happen, but it certainly can, depending on where we're injecting and how close to the surface of the skin, depending on what we're trying to achieve. So, but again, no one leaves the office looking, but for the most part, you leave, looking pretty much, already seeing results, immediate gratification.
Awesome. So I'll follow up with this because you kind of already touched on it. For you, Suzanne, if you do bruise, how long does the bruising usually last?
It's, it varies from person to person, how thick the skin is, what area. Again, I tell patients don't do it, right before an event of some sort, obviously. But, life is going to happen. You're going to have to go to the grocery store. You're going to have to, do things. So I don't think necessarily you need to take, time off work or downtime. That's a personal kind of decision. But, I think a good rule of thumb is 2 weeks potentially. But again, we have, great resources to really speed up healing and prevent and treat any post-injection swelling or bruising.
Okay, awesome. All right, Cam, I take a monthly injection for psoriasis. Is this treatment compatible, or is there anything I need to worry about with that?
So I'm assuming with the injection that it is for the autoimmune, so it'll suppress your immune system. While there's not a direct contraindication, I would go case by case and see what kind of condition you're in when you come in to get treated. And you really have to, we have to be proactive about cleansing the skin prior to injection so that you can heal and reduce your risk for infection.
Awesome. All right, Brittany, are there any side effects that I need to worry about? And if I book a consultation, can I get my filler done the same day?
So side effects, I think we already kind of touched on bruising, swelling. There can be some more severe side effects. They're very rare, and we are very proactive. I think all of us as injectors, at mitigating and doing everything we can to give you the safest treatment, use the safest injection practices to minimize as many side effects as we can. But, you are getting stuck with a needle. And so there is some bruising and swelling that will come with that. And then as far as the second part of the question, will you say the second part again?
If I book a consultation, can I get my filler done the same day?
So that can be done. Again, that's case by case basis. So it just depends on how the consultation goes. If you are a candidate for filler, if you haven't like if you've had a major surgery in the past 2 weeks, or you had a dental procedure done in the past month, or you're on some sort of medication that causes a problem, then we'll have to postpone that. But if you are a candidate and we do have the time, we do consultations and same day treatments if it works out and we have the time for it. But again, that'll just kind of be a case by case basis depending on the patient.
Perfect. All right, Suzanne, question for you. What about necklines, like the necklace or tech lines? Can RHA be used to treat that?
Oh, absolutely. I've done several patients, and RHA is actually a really nice product because it's so smooth and, like I said, it has that resilience. So those lines, are from, like I said, a lot of patients are, we're looking down at our devices and typing, so we get those lines across the neck. So, and that skin is very thin, so we have to be careful what we use there. So RHA is kind of malleable. I can really mold it to get into that crease, and so it's actually my product of choice for necklines.
Perfect. All right. See, I'm trying to make sure I'm getting all of the questions here. Cam, what would you say in regards to how long someone should wait to fly after having their fillers done?
I typically tell patients to wait about 48 hours. I think the risk is that the product may move, although I've never had a patient that claimed that their product moved during in the air. But yeah, I think after any treatment that you should wait about 48 hours, give yourself your body some time to heal.
And to follow up on that, if a patient was having laser facials done for something like rosacea, do those treatments need to be spaced out, or does that dissolve the filler at all, or what would you suggest on spacing those out?
I have not read anything about lasers dissolving fillers. In our practice, I would typically have the patient wait 2 weeks, give your body some time to heal before you do another treatment. Sometimes, when you're doing too many treatments, it can impede healing. So if you've just gotten filler, you want your skin to heal properly before you add another treatment.
Awesome. All right. And then we do have another question coming up. I know that y'all are going to be offering some specials for this event, and we're going to get some details on those in just a second. Just wanted to go through these really quick to see if we have some additional questions for you. All right, Suzanne, I have one for you. If someone decides to let the fillers wear off, will the area that was treated look stretched?
No. So basically, eventually, the products will be metabolized and you'll go kind of back to baseline. But again, the volume is, embraced, it's going to go into the making of your skin. It's not like that we're, making it look swollen, or we're just really just giving that lift. So the product is going to be very gradually, metabolized. It's not like you wake up one day and it's gone. So no, you won't look like your skin's been stretched. But it does need to be maintained, just like anything in life. We have to maintain our homes and our cars, and we have to maintain our, ourselves. So it's absolutely, recommended to follow up and do, reconsultations. But my patients, honestly, that have been treated with RHA, I've been really, really happy with the duration and the longevity. I mean, I have patients coming back a year and a half later and still have a great results per the photos we've taken. So, but it's case by case as well. Patients lost a lot of weight in that time frame or something. They might have a little bit more volume loss. So, again, it's a great product, really nice duration, and now you won't look like your skin is stretched now.
Awesome. All right. So for Cam and Brittany, how many areas can be treated in one appointment? So I guess, can you do like a full face? Like, is there a number to the syringes you can get done in one day? How can you fix an entire face, I guess, is the question.
Yes, I think so. So we typically practice in a full face rejuvenation when we do. Some patients, though, then again, it is patient by patient. So some patients can only handle so much, especially if patients are really afraid of the needle. Some patients want to do it step by step. So can we do it all in one day? Yes, and we can also space it out.
Mm-hmm. I think adding to that, it's definitely a process. So while we will, in our consultation, we will assess your full face and we will develop a treatment plan. We may not get all of the syringes in that you need that day or all of that correction, but we will, go ahead and assess for that and be able to tell you, you're going to need this many visits, this many syringes, and really develop that customized treatment plan to address the full face. And we're really big on full face correction. If someone comes in and just wants to treat one area, we're going to assess the full face and we're going to let them know, hey, if you did this, this, and this is what's going to give you your best result.
I think too, sometimes when you come in and we start with the full face and, we start up the mid cheek here. And once we get this corrected, a lot of times there's not a whole lot of correction here and here after we've already corrected up here. So sometimes the assessment changes right after injection.
Mm-hmm. Awesome. And if you were going to be doing a full face and spacing out those appointments, would you do that, you say maybe every 2 weeks so that you could see the healing? Is that how you would do that?
Mm-hmm. Yes.
Yeah,
Awesome.
we would wait at least 2 weeks.
Okay, perfect. All right. Suzanne, do you know what the specials or giveaways would be for this event?
So I think that we are going to do choose a winner per region. So that means, somebody from my area and someone from in their area. So they'll get free product, 2 syringes. So in order to be eligible for that giveaway, you need to call and book a consultation so we can get you assessed, and then we'll put you in a raffle to win 2 free syringes. In addition, there's going to be some specials and giveaways specific to the locations and offices. So call the office, book a consultation, and ask about the specials, and we'll tell you more about our giveaways. But we definitely have a lot of goodies for patients, so get on the books.
And just to remind everybody, after this event, you will be contacted via text. So just reply yes if you do want to be contacted for a consultation, and then someone from your area will be getting back in touch with you in regards to that. And then once you do get your consultation, you can find out what the specials are for the office that you'll be seeing. And the questions are wrapping up. So if anyone has any more questions, please enter those now so that I could get them over for you to get those answered. And ladies, did you have anything else that you wanted to add?
No, thank you for your spending time with us this evening. I know everybody has a busy schedule at home, but thank you for carving some time out of your day and sharing it with us.
Yeah, and we look forward to hopefully seeing you guys for some consultations with us, and we can talk, more patient to patient and answer your more specific questions in the consultations.
Yeah, I just want to say, thanks everyone for watching and participating. I think it was really nice, and hopefully you guys learned something, answered some questions, but any concerns at ease. Yeah, we're excited to treat and see you in person. So call us and get on the books, and we'll see you soon.
Thank you guys.
Bye.